Good afternoon, everyone. I'll be talking on comparative analysis of white-to-white measurements from different devices for phakic IOL sizing. So phakic intraocular lenses are clear implantable lenses for correcting high degrees of refractive error, and they are excellent options for vision correction in patients unsuitable for laser vision correction, the advantage being they preserve the accommodation. The horizontal white-to-white diameter decides the ideal size of the phakic IOL and can be measured by various tools. So all these devices give readings which are slightly different from each other, adding to the confusion of choosing the accurate white-to-white. So the aim of our study was to compare white-to-white measurements obtained from digital calipers with Pentacam and IOL Master 700. We assessed if digital calipers values can be used for IPCL size calculation, which was done by observing the post-op vault on ASOCT. So our study was a single center, single surgeon, retrospective and cross-sectional, where we included patients above 18 years of age, not suitable for corneal refractive surgery and no previous corneal refractive surgery, and the refraction was stable. We had 50 eyes of 25 patients included in our study. For IPCL sizing, as we all know, if ACD is more than 3.5 mm, 1 mm is added to the measured horizontal white-to-white, whereas if the ACD is less than 3.5, 0.5 is added to the measured horizontal white-to-white. And then the calculated lens size between available lens diameter were rounded down for ACD less than 3.5 and rounded up for ACD more than 3.5. Horizontal white-to-white diameter was measured using IOL Master 700, Pentacam HD, and digital calipers. Vault is the distance between the posterior surface of the IPCL and the anterior surface of the crystalline lens, and it's measured on ASOCT on 6 weeks follow-up. Coming to the results part, the mean white-to-white measurement from Pentacam and calipers were almost similar and close to each other. And while comparing the Pentacam and the calipers, the bias was the minimum and the correlation was the maximum when you compare the Pentacam and calipers. While using the digital calipers, maximum patients had a vault of in between 750 to 1000 on ASOCT 6 weeks post-op. Coming to the discussion part, earlier studies had shown that IOL master measurement have highest reliability in measuring white-to-white, but in subsequent studies, it showed that there's no correlation between Pentacam and IOL master white-to-white. And in one of the studies, it showed that they recommended a correction factor of minus 0.34 for proper vaulting with IOL master. In accordance with our study, there was a study which showed that there is a strong correlation between Pentacam and calipers white-to-white measurement. Hence, to conclude, the precise horizontal white-to-white measurement of the cornea is a key parameter for achieving potential optimal size phakic intraocular lenses. Readings of white-to-white measurements using Pentacam and digital calipers were very close to each other, hence indicating their interchangeability. IPCL sizing was acceptable with white-to-white measurements of digital calipers and provided optimal vault. And corneal white-to-white measurements using digital calipers is a reliable method and prevents over or undersizing of the IPCL. Thank you.
You are using the IOL Master 700
Yes,
or the
sir.
500?
Yes, 700.
And the digital calipers measurement which you all were taking,
Yes,
were you
sir.
taking it in the supine position or?
Supine positions.
So if you had a difference between your digital caliper and IOL Master Pentacam,
Yes, ma'am.
then did you take an average or how did you go about it?
No, ma'am, most of the times the digital calipers and the Pentacam readings are almost close to each other. And when we checked with the ASOCT post-op vault, it was like matching with it. So we used to take the average of the digital calipers and the Pentacam.
For each and every patient, you took the average
Yes,
of the
ma'am.
two.
Yes, ma'am. Sorry, sir.
The measurement is also subjective. So the single person was done in both Pentacam and
Yes.